Personal hygiene and cleanliness helps promote both physical and emotional health for the patient. Skin acts as the first line of defense against infection. Caring for the skin helps to prevent such things as rashes and dry skin, which interrupts the body's first line of defense by creating a portal of entry for microbes. The frequency and method of general skin cleansing are determined by many factors, including the patient's state of health, the patient's ability to care for him or herself, the policies and procedures of the facility, and the patient's own personal choices. In this video, we will explain how general skin cleansing can benefit a patient's health, understand the importance of good hygiene in relation to a patient's physical well-being. We will demonstrate proper technique for patient general skin cleansing, discuss the benefits of implementing HibiCleanse into the daily routine of patient general skin cleansing, and review identified questions related to the use of HibiCleanse for routine general skin cleansing. Before you begin, wash your hands following facility protocol and apply standard precautions such as wearing gloves during the procedure. Next, you will need to gather your supplies. Various supplies are used for general skin cleansing, many of which you are already familiar with, such as the basin, HibiCleanse, washcloth and towels as needed, and other articles specific to the facility such as skincare products. Before beginning general skin cleansing, explain what you are going to do to the patient. Close all doors and windows and provide for privacy. Position the height of the bed for good access and lock the bed wheels. If using a basin of water, always check the temperature using a bath thermometer. The water temperature should be between 105 and 115 degrees Fahrenheit. Basin water can be hotter than a regular shower since the patient will not be immersed in the water and the water will cool more quickly. If you plan to wash your patient's hair, use their regular shampoo. Then, rinse hair thoroughly to remove any shampoo residue. A washcloth is wrapped around the hand to form a mitt for cleansing the body. All types of washcloths are acceptable as long as they are clean. Towels are used to gently pat the skin dry, but can also be used to aid in patient privacy and protect the bed from dampness. Wash the body from the cleanest to the dirtiest areas. Wash around patient's eyes beginning at the inner corner with water only. Using a different portion of the washcloth, clean the other eye using the same method. Rinse the washcloth and wash the face and ears with water only, then wash the rest of the face. Do not use HibiCleanse on the face. Do not add HibiCleanse or any other soap to the water. HibiCleanse is either poured directly onto the washcloth or directly onto the skin for all body areas except the face, eyes, ears, mouth, and genital area. Remember that HibiCleanse is not to be diluted. Apply just enough HibiCleanse to cover skin beginning with the upper extremities, then lower extremities moving to the chest and abdomen. Wash skin gently. Rinse thoroughly with warm water and gently pat dry. Reposition or turn the patient if necessary and apply HibiCleanse to the back and buttocks following the steps above. Since the use of CHG is contraindicated for mucous membranes, cleanse the perineal area according to facility protocol. Dispose, clean, and store supplies according to facility protocol. Do not use regular soap, lotion, powder, or deodorants after washing with HibiCleanse. HibiCleanse is the gold standard in antisepsis. It has an immediate and persistent action that lasts for up to 6 hours. It is non-toxic and non-allergenic. It is non-irritating. It has a broad spectrum of activity. It's easy to use. It's mild with a pleasant fragrance, and it's cost-effective. General skin cleansing as part of an effective strategy in the prevention of surgical site infection. AORN Recommended Practices Recommendation Number 1 states that patients undergoing Class 1 surgical procedures below the chin should have 2 preoperative showers with CHG before surgery. The rationale for this is that Staph aureus is the most common organism causing surgical site infections. The act of washing and rinsing removes microorganisms from the skin. 4% CHG is the most effective. Showering or bathing 3 times with 4% CHG was found to reduce skin flora 20-fold. The Centers for Disease Control recommend showering or bathing at least the night before surgery with an antiseptic agent. 4% CHG is more effective than other agents. The rationale for this, under Category 1B, is that it is strongly recommended with some scientific evidence. Should Hibiclens be left on the skin? No, Hibiclens is a soap and should be rinsed thoroughly from the patient's skin. Is Hibiclens irritating to the skin? No, Hibiclens is the least irritating and closest formulation to the patient's own skin. The pH of Hibiclens ranges from 5 to 6.5. What are some compatible lotions that can be used with Hibiclens? Please visit the following websites for more information on this topic. In summary, general skin cleansing serves many purposes for your patients. It helps a patient feel relaxed and refreshed, cleans the skin and eliminates body odor, exercises muscles that might otherwise not be used, stimulates blood flow to the skin through touching, which helps to prevent skin breakdown, gives the healthcare worker an opportunity to observe for skin problems. Cleanliness of the body is essential for a patient's physical and emotional well-being. Healthy skin helps protect the body from being invaded by infection-causing microbes. Feeling clean also improves a patient's comfort level.